Hi my beauties. Okay, I'm doing another at-home ratchet unprofessional YouTube video on content you guys want to see. So I just posted in my story, what do you guys want to hear about if I'm going to do a YouTube video tonight? And many of you guys were requesting supplements and skin supplements. So I think I've posted a YouTube video on skin supplements before. There has been a little bit that's changed, but not that much. So just wanted to answer your questions and answer your requests to talk about skin supplements and which ones I recommend as a physician and as a dermatologist. So I'm not going to go in any particular order. I'll just kind of think of my top supplements that I take myself for my skin and that I recommend to my patients. So collagen peptides are really important, and collagen is present in various other organ systems in the body. So musculoskeletal, the bones, the cartilage, the tendons, the eye, nails. It's in a lot of different structures in our body. So if we're taking collagen supplements, how do we know that the collagen building blocks are going to the skin and they're not going to the eye or to the bones? We don't. So I actually looked into this about a year or two ago, and I did like a whole meta-analysis research, and I actually went on a couple threads and forums with other physicians and dermatologists around the world, and all board certified, and kind of asked, you know, what their recommendations were for their patients, because there's various forms of collagen peptides on the market, and certain ones are more effective than others. And then also, I just wanted to do a review and kind of search the literature out there to see if when we ingest collagen through the GI tract, which gets systemically absorbed, so anytime that you get any nutrients or proteins absorbed from the GI tract after you ingest them, how does the blood circulatory system take it to the skin where it needs to be? And you have to remember, at the top layers of the skin, there's passive diffusion. So the blood vessels are kind of deeper into the papillary dermis, and by the time any nutrients or vitamins or proteins or peptides or amino acids get diffused up to the skin, they have to make their way. It's hard for you know, building blocks of collagen and proteins and amino acids to make it to the skin. However, what I found in my research and when I'm collaborating with other colleagues investigating this topic, when your skin is stimulated to make collagen, so whether you're using like a Retin-A, say you do an at-home peel, say you have a laser treatment, and your skin is upregulated to make collagen, it has been shown through data and many meta-analysis and research and peer-reviewed literature publications in the dermatology and medical literature that your skin gets upregulated to make collagen, and so it will have increased uptake when you're systemically absorbing it. So that is in and of itself proof that it could be beneficial, because I was actually skeptical. I'm like, before I tell my patients to take collagen supplements, I want to make sure that it's actually going to be beneficial. Otherwise, you know, there's no point in doing it. And honestly, seeing patients who I do laser on and do resurfacing on, when they take their collagen peptides, like for the weeks and maybe even months following, they get a better result. And they come in saying, Dr. Capel, like my skin looks so much better. And even after doing laser, continuing on the collagen supplements and collagen peptide powders, you know, I love the ones by Vital Proteins, but there's a lot of different ones out there. They notice that their skin looks better, and I can see that their skin looks better. And when I look at their skin under the microscope, if we do a biopsy, or if I, in the past, you know, when I was a Mohs surgeon and I would look at their skin under the microscope, I could see the changes as well. So that is in and of itself really evidence-based medicine and proof that collagen peptides can be beneficial. Of course, I'm sure that there's certain brands that are better than others. I really like the Vital Proteins collagen peptides. I'm sorry if you hear my son playing Fortnite with his friends in the background. It's a Saturday night, and I'm just taking a minute to film this YouTube video, keeping it authentic and real with you guys. Because if I wait till I have like a perfect situation with no kids and my ring light and all that good stuff, I'll never post. So I'm just in my kitchen on my iPad with no filter, just filming this video on the fly, answering your questions. So bear with me, and thank you for following despite my unprofessional YouTube videos. So the next supplement I probably want to talk about is vitamin C. So vitamin C, as we know, boosts our immunity. It's really important for our immune system. It's a water-soluble vitamin. So unlike vitamins A, D, E, and K, which are fat-soluble, which you can actually overload your body with because it's stored in the fat and you can't excrete it out of the urinary tract, vitamin C you can never overdose, or vitamin B either, on those two vitamins because they're water-soluble. When your body reaches its limit of what it needs, your kidneys will excrete it through the urinary tract. So You never worry about taking too much vitamin C. I mean, I usually take either 500 milligrams or 1,000 milligrams, and that's all you need for like a daily dose. And you know, if I take more than that on an empty stomach, it makes me a little nauseous. So aside from that, you know, try to get about 500 to 1,000 milligrams in a vitamin C a day. Ascorbic acid is really important. It's also important topically, but we'll strictly keep this video for systemic oral supplements. Vitamin C is really important in a lot of like wound healing, cellular turnover, cellular renewal, and overall cell health, meaning the keratinocytes, the melanocytes, the immune cells, the lymphocytes, everything, and the mast cells, all the cells in the skin are really, you know, all benefit from vitamin C. And vitamin C is a cofactor in collagen synthesis. Copper is as well. So if you're remembering chemistry, if you guys are any science majors out there, you know, all your enzymes and all your coenzymes require different catalysts or different coenzymes to produce collagen or have whatever, you know, conversion reaction that they're synthesizing. So in collagen synthesis, vitamin C is an important component of that. So that is also a really important supplement to be on, and it's also, you know, overall beneficial for your overall health and your immunity and all that good stuff too. So collagen peptides, vitamin C. What else? So any free radical scavenger, because free radicals not only can cause cancer, not only in the skin, but in all areas of the body, but they can also cause premature aging. So ultraviolet light or even HEV visible light emitted from our devices, environmental pollutants, things that our skin encounters on a day-to-day basis. There's free radical formation of these free radicals that can degrade collagen, degrade elastin, and when your skin is unhealthy or it has damage or DNA mutations under the microscope, you know, your collagen fibrils are all disorganized and non-functional. The elastin fibers, you get something called solar elastosis under the microscope. You can see these histological changes, and it's basically just damaged proteins and damaged extracellular matrix proteins in the skin, which can make you look wrinkled and weathered and dull and brown spots and bleh. So doing things that are going to bind these free radicals and be free radical scavengers, potent antioxidants are really important. So if you guys have your favorite antioxidant that you take, go ahead and be sure to take that every day, not only for your skin, but for your overall skin health. Again, sorry for the kiddos screaming in the background and the dog barking. But my two favorite, and this is just, you know, what I learned in medical school, and, you know, that, you know, just keeping up with the peer-reviewed literature, astaxanthin and NAC. So NAC, I think, is N-acetylcysteine. So those are the two most powerful antioxidants that are important for fighting off cancer and premature aging. So all things go together. So, you know, back when I was, you know, in residency, everybody wanted to look younger and look better. But now I feel like the focus is just to look healthier. So like healthy skin by default just looks younger. If under the microscope your skin is healthy and it's functioning optimally and there's lots of antioxidants, a lot of vitamins, a lot of nutrients, and a lot of, you know, love that's being given to your skin cells, your skin's gonna look amazing and you're gonna look younger. But you're also, you know, doing this to prevent skin cancer, to prevent photo aging and all those bad things that lead to like skin disease and all the different dermatologic conditions, rosacea, seborrheic dermatitis, acne, melasma, all these things that get dysregulated. Once you get the skin cells to be regular and to function properly, you'll have beautiful skin that looks youthful by default. So part of that is taking antioxidants and vitamins and supplements that nourish your body from the inside out, and that will manifest with beautiful, healthy skin. So in addition to antioxidants, you know, other vitamins, vitamin E, vitamin A. You know, vitamin A is what retin A is. An oral form of vitamin A is what Accutane is. So I don't want to get on this controversial topic because Accutane has a black box warning. If you do Google it, you'll see a lot of bad things about retin A, but a lot of dermatologists take like a 20 milligram pill once a month or once a week just for overall like anti-aging and to keep the skin healthy. But it gets kind of shady because, you know, we have to prescribe it as physicians, and you know, it's prescribed for acne or for some dermatologic conditions, and not everybody has access to it. So I hate talking about things like, okay, well, all dermatologists are on 20 milligrams of Accutane once a week, but you can't have it because you don't have a prescription for it. So I don't want to go down that road. I actually haven't taken retin A for a while, but I was taking it like, you know, 20 milligrams maybe once a month just for overall skin health. But that could be, you know, that could be controversial. So I'll say that I'll do a whole Accutane talk if you guys want to hear about it. I'll do a whole another Accutane video on YouTube if that interests you as well. But vitamin A, which we can get from green leafy vegetables, you can get it from, anything, a lot of the orange fruits and vegetables. So yams, sweet potatoes, carrots are chock full of vitamin A. It's also good for your vision. And vitamin A really keeps the skin cells on point. It keeps the cellular turnover functioning optimally and very healthy. And it just helps with like wound healing. It helps with anti-inflammation, and it helps with a lot of other skin conditions as well. So we give vitamin A as a prescription for a lot of dermatologic ailments and conditions. So that in and of itself should show you that it's beneficial for your skin. And then vitamin E is really important. Vitamin E is important for maintaining the lipid bilayer of the cell membranes of the cells within the epidermis and the dermis. And it's also important for, again, wound healing. It's important for intracellular communication. It's important to maintain your skin barrier, which I'll talk about in a little bit, or I'll talk about in a different video because I don't want to go off on a tangent, but your skin barrier, which is a natural barrier that prevents transepidermal water loss and keeps the skin hydrated. It also helps from keeping microorganisms from entering and infecting the skin, as well as allergens, which can cause allergy and irritation and inflammation like an eczema. So, that is an important role of vitamin E, is maintaining that healthy lipid barrier to protect your skin from the outside external antigens that can wreak havoc in the skin and cause disease, cause cancer, and cause autoimmune skin conditions as well. So I think we've covered most of them. Other things that may be a little bit more controversial now that I talked about before, biotin. So biotin's always been for healthy skin, hair, nails, but the FDA released a warning that it could mask a positive troponin test for myocardial infarction. So in English, what that means is if somebody's having a heart attack, one of the labs that they use in a blood draw to see if there's any myocardial infarction or heart attack or disease or loss of healthy heart tissue, that lab can be masked by biotin. So a lot of my dermatologic colleagues aren't recommending biotin to their patients anymore, and I kind of am not either. Not that people who take biotin are at risk for having a heart attack, but if you were to have a heart condition or a myocardial infarction, which doctors call heart attack, then it would kind of skew the lab there. So biotin I'd probably put aside for right now and not incorporate that into your supplements. So thinking about everything, the omega fatty acids, just like vitamin C, are really important for maintenance of the barrier, intracellular communications, and cell membrane health, which is the lipid bilayer that encapsulates the cell. And I think that's pretty much it. So just going over it again, the collagen peptides that are important in collagen synthesis, it's the collagen building blocks, because if you take collagen itself, it's too big of a molecule to pass through the intestinal wall and get into the circulatory system to get to the skin or to the eye or to the cartilage or the bones or wherever it's going. So collagen peptides, not proteins, are important. Vitamin A, vitamin C, vitamin E, omega-3 fatty acids like fish oil, eat it in salmon, get it through natural healthy fats, avocados, almonds, things of that nature, chia seeds, flax seeds, all that good stuff. And then your antioxidants, astaxanthin and N-acetylcysteine or NAC. And hopefully I'm not missing any, but if I am, you guys can probably tell me in the comments and I'll address it later. I'm not good with getting back to my YouTube comments, but I do read them and I take them into consideration, and I usually do subsequent YouTube videos addressing your comments and concerns. And then the last thing I want to say is HelioCare. So HelioCare contains Polypodium leucotomas, which is a fern-based plant enzyme which protects ferns from ultraviolet light damaging DNA-induced mutation. So basically, like when ferns are doing photosynthesis and they're out in the sun, they're protecting their DNA from getting mutated, and they're just taking that UV light and turning it into energy through photosynthesis. But they also have this really cool protective enzyme that we can harvest as humans in our skin to protect our DNA from UV-induced damage and mutations, which can protect us against not only cancer but anti-aging. So the cool thing with anti-aging, it always goes hand in hand with anti-cancer. So even chemoprevention of skin cancers, when we use like even, not only just, things like, Aldera or Efudex, some of these topical chemotherapy agents, but sometimes, just Retin A is good for preventing, actinic keratoses or precancers and skin cancers. And I wish insurance companies would cover Fraxel or resurfacing or CO2, because lasers are, important in keeping skin cancer away and protecting your skin against skin cancer. So whenever you're doing things that are healthy for your skin and anti-cancer, and to get your skin on a healthy track to where you're avoiding dermatologic conditions like I mentioned before, rosacea and acne, melasma, all these things, you're also making your skin healthy and protecting it against cancer. So they all go hand in hand. So not only is it important to use good topicals on our face on a day-to-day basis on our morning and night regimen, but also to be ingesting supplements that make your skin not only beautiful and look younger, but are healthier, because healthy skin looks younger and is beautiful. So that's the take-home message for today. If I missed any supplements that are vital, I'm sorry. I'm remembering now, I probably should have mentioned niacin. Niacin's really important too, but can cause flushing, so many people don't like it. But it is also in the HelioCare supplement that I just mentioned before, in the, I believe, the HelioCare Advanced. So hopefully this helps, and let me know what else you guys want to hear about. And I love you guys. Thanks for watching.